Hey guys, I want to jump on here real quick and share a case study with you, but a little bit of a twist for a case study. So, just got done with patients today, had an eval um, that was, how old was she? She's probably like 65, 70, coming in with a complaint of several months of groin pain, low back pain, some weird tingling in her thoracic spine, and some intermittent shooting pain down her legs. So, sounds pretty interesting, right? So, I want to give you a heads up here. This is going to turn into a rant because of what this patient has had to go through. But it's going to be a rant with purpose. So instead of just going off, I want to teach you something about this patient and what I did. And I'm not going to go deep into the treatment. I'm going to go into patient education and dealing with a patient who, in my opinion, has been getting screwed. And basically, nothing has that she has been experiencing treatment wise has been anywhere near where it should be. And I've had several people ask, you've talked about physical therapists. We know you are a physical therapist. Or actually, they say, well, you talk about physical therapists and tell us how terrible physical therapy is. Why don't you ever get in on chiropractors? So here we go. So one of the reasons I don't get in on chiropractors is I'm not a chiropractor. I don't believe in what chiropractors do, but I don't believe in what physical therapists do for the majority either. So I don't get in on chiropractors because that's not my profession. That's not my deal. But I do have and have had chiropractors that I have taught 180 to and go through the shift. And I hear the same stories from chiropractors that I hear from physical therapists. So here's my rant on chiropractor garbage and how I educated this patient about what's going on so I could give her the best treatment that she can possibly get, not only here, but how she can educate herself and have an understanding about what she's been doing, why it's total BS and why she's been wasting money, and what she needs to do to get out of that and actually get to where she wants to go. All right, so here we go with the case study with a little bit of a twist of a rant with purpose. Let me know if you like this. All right, so patient comes in and she's got her all of her testing procedures that she got done from the chiropractor, and I can see what they are. I already know what they are without even looking at them. She puts them on the little table that she puts her phone and everything on. And I say, okay, so tell me what's going on. And she's like, well, how far do you want me to go back? So here is where I give people a little bit of leash and let them talk about what they want to talk about. But as soon as we start going back until they were 12 years old and fell off a horse, I reel them in and say, okay, let's get down to what we actually need to talk about. So she started off with, well, for years I've done this and I've had this problem. And then a year ago I had bilateral groin pain. That was an issue. And so I started seeking help for that. And then about 6 months ago, it turned into like tingling things that I was getting in my shoulder blades and my thoracic spine. And then it turned into low back pain. And now I feel like I'm starting to have leg symptoms. And so she's reporting all of these weird symptoms. And I just keep saying, okay. And so I finally cut her off and I said, okay, so what are these symptoms keeping you from doing? What can't you do that you want to do? She said, well, I'm pretty active, but I have to admit that I'm also really sedentary because my hobby is quilting and knitting, which is mostly sedentary. And she really doesn't want to increase her activity level, but she's tired of just having pain. Okay, so I said, okay, so do you have deficits in strength? Does it feel like you're weak when you're walking up and down stairs, getting out of chairs? Do you feel like you're losing your balance? And that's when she said, yeah, I feel like I'm getting weaker. My legs are getting weaker when I do go for a walk or when I do have to go up and down the stairs. I feel like that's becoming more of a problem. I said, okay, so is today a typical day? So remember, the most frequent questions that I want to know is there a mechanism to what's going on? Or was there a mechanism? What have they done for it? What do they want to be able to do that they can't do? Is today a pretty typical day as far as their symptoms are going? That's about all I want to know. I don't want to know, is the pain burning, numb, tingling, sharp? dull, whatever, blah, blah, blah. All I want to know is what happened? What have you been doing for it? How's that been working? And is today typical? Am I seeing you at a normal level? So get her up out of the chair, and before she gets out of the chair, she said, "Well, I have my chiropractor reports of all my scans." And I said, I don't need to see that. She said, "Okay, do you want to know what they told me?" I said, "Nope, we'll talk about that in a little bit, but I don't want to know what they told you." And so she took off her shoes. I could see that she had orthotics. And she pointed out, she said, "Well, it's weird to walk with my shoes off because I have these inserts." And so I took the inserts out of her shoes, different kind of insert that I hadn't seen, different logo. And what do you know? It's from the chiropractor that she went to see that ran all the bogus tests. So I said, "Did you get these from the chiropractor?" "Oh yeah, she gave those to me." And I said, "Well, why?" And she said, "Well, when she did my scans, she said that I was really crooked, and that if I stand on these, then that will give me a lift and give me more support, so then I'm not so crooked and my shoulder isn't lower on one side than the other side." And I said, "Okay, well, we're going to get rid of these." So I put the orthotics on the table, and I said, "Okay, go ahead and walk." And so she walks away, and she comes back, and she said once again something about the shoulder, and I said, "Well, it's because of your scoliosis." And she said, "What?" And I said, "You didn't know that?" I mean, she has a baggy shirt on, and she has obvious scoliosis. Her pelvis is crooked, tilted, her spine, scoliosis, shoulder down because of scoliosis. I mean, everything is textbook scoliosis. And she said, "What? I have scoliosis?" And I said, "Wait a second. You went to a chiropractor that did all of these scans and hooked you up to all of these machines and made you inserts because your feet are this and that. And she didn't even tell you that you have scoliosis?" And she goes, "No. Is it that obvious?" And I said, "Yeah, I think most non-medically trained people could look at you and tell you have scoliosis." And she's like, "Okay." And I said, "So forget about the scoliosis. Forget that I told you that." And I run her through the screen. So toe touch, obvious scoliosis. Squats down and is completely shifted. And I said, "Does that feel like a normal squat, or does that feel like you're stiff, or does that feel like you're leaning one way?" She goes, "No, that feels pretty typical." And I said, "Okay." Have her do single leg squats. She's all over the yard. Can't stand on one foot by itself. I said, "Okay." So did upper body, cervical spine. That was pretty good. Put her on the table, start testing tough stuff, and she's failing all quads, all hams, all glutes, all hip rotators, dorsiflexors, plantar flexors. So she's failing everything. I'm going through and treating things, and she's like, oh, wow, oh, what happened?" So remember, before I tell patients what we are doing with neuromuscular facilitation tests, how I'm refacilitating the inhibited muscles, before I explain that to them, I test and treat and retest at least 4 or 5 muscles so they can feel the immediate difference between inhibition and facilitation.